a warm, empathetic, medically authoritative, feminine voice that's compassionate and professionally engaging. Or asked the other day, what can you do to help keep your pelvic floor healthy? And I realized this is something so many people wonder about, but rarely get a comprehensive answer to. So today, I'm going to give you exactly that. I'm Dr. Elena, and today we're talking about your pelvic floor, one of the most important yet most overlooked parts of your body. Now, you may have heard of the pelvic floor before, or maybe you're thinking, what on earth is that? Either way, by the end of this video, you're going to understand exactly what it is, why it matters so much, and most importantly, how to keep it healthy for years to come. The pelvic floor is essentially a bowl of muscles that sits at the base of your pelvis. It attaches to your backbone, to your pelvic bones on the sides, and to the front of your pelvis. Think of it as a hammock of muscles that supports everything above it. Its primary job is to help hold your organs in place, but it does so much more than that. Your pelvic floor helps you with sexual function, arousal, orgasm, and pleasure. It helps with urination, both holding urine in when you need to and releasing it when you're ready. It helps with bowel movements. It helps stabilize your entire core when you walk, run, lift, and move through your daily life. And here's something most people don't realize. It even helps with lymphatic drainage, which is important for your overall health and immune function. So, this is a very important group of muscles that is very often completely forgotten about. And that's because when everything is working well, it's just operating quietly in the background, doing its job without demanding any attention. You don't think about it, you don't have to. But when you develop issues with your pelvic floor, it can absolutely wreak havoc on your quality of life. And what do I mean by havoc? Pelvic floor dysfunction can cause issues with constipation, difficulty having bowel movements or needing to strain excessively. It can cause urinary urgency, that got to go right now feeling that disrupts your day. Or conversely, it can cause difficulty urinating, where you feel like you can't fully empty your bladder. It can cause pain with sex, which affects not just physical comfort, but emotional intimacy and relationship quality. It can cause pain with erections for men, pain with ejaculation or orgasm, and it can even contribute to chronic lower back pain that seems to come from nowhere. So I want to protect you from developing these issues, because sometimes you're doing things unknowingly, day after day, that are slowly affecting your pelvic floor over time. And to be honest, I care about each and every one of you watching this. I don't want to see you struggling with these problems. I want you living a happy, healthy, wonderful life where your body supports you in everything you want to do. So today we're going to cover 11 things you can do and avoid doing to keep your pelvic floor in excellent condition. Let's get into it. I know this sounds simple, but it's one of the most common habits I see causing problems. I understand that sometimes you have to hold it. You're on a long drive with no rest stops in sight. You're in the middle of something important that you can't step away from. Life happens. But don't make it a habit. I see this all the time with certain professions. Teachers who can't leave their classroom full of students. Nurses who are caring for patients and feel guilty taking a bathroom break. Surgeons like myself who get into long procedures and simply can't step away. It's very easy to get used to holding your urine because you feel like you just don't have time. You're taking care of patients, watching children, working with clients, or doing something that makes stepping away feel impossible. The issue is that if you continue doing this over years, several problems develop. First, your bladder can adapt to holding more volume, but not in a good way. The bladder muscle can become stretched and weakened over time. When it gets weaker, it becomes more difficult to fully empty. You might start feeling like you always have a little bit of urine left, or you might start experiencing more frequent urination because your bladder never quite empties completely. Second, your pelvic floor tends to tighten in response to holding urine in. It's working overtime to help you not have an accident. Over time, this chronic tightening can lead to pelvic floor dysfunction, which paradoxically can make it even more difficult to urinate when you finally get to the bathroom. All of these things together can lead to serious problems down the road. Some people even end up needing to use a catheter, a tube inserted into the bladder, to empty their bladder because the system has broken down. Please don't let years of holding your pee lead you there. When you need to go, go. This one is huge, and I cannot emphasize it enough. When you're constipated, you find yourself straining and pushing to have a bowel movement. And what are you straining and pushing against? Your pelvic floor. Every time you bear down with force, you're putting tremendous pressure on those pelvic floor muscles. Over time, this chronic straining can weaken them, stretch them, and create dysfunction. It's really important to approach bowel movements differently. When you sit on the toilet, focus on relaxing rather than pushing. Elevate your legs to put your body in a better position. I absolutely love a squatty potty. I have one myself at home. It elevates your legs and puts you in the proper ergonomic position that allows your bowels to evacuate more naturally, with less straining. Make sure you're getting enough fiber in your diet. Most people don't get nearly enough. Fiber adds bulk to your stool and helps it move through your system more easily. Make sure you're drinking enough fluids. Dehydration is one of the most common causes of constipation that I see. Your body needs water to keep things moving. Make sure you're moving your body regularly. Physical activity stimulates the digestive system and helps prevent constipation. And if you've tried these things and you're still struggling, please talk to your doctor about other ways to address your constipation. There are safe, effective treatments available. Don't just live with it, because living with constipation means living with chronic damage to your pelvic floor. You've probably heard the phrase exhale on exertion when it comes to lifting weights or heavy objects. But do you know why this matters so much? When you exhale during the exertion phase of a lift, you stabilize your pelvic floor. Your core engages properly, and your pelvic floor is doing what it needs to do to support the load. But if you're lifting and holding your breath, which many people do instinctively, your pelvic floor actually relaxes at the worst possible moment. You're increasing the pressure in your abdomen dramatically, while your pelvic floor isn't braced to handle it. This means you're working against yourself. You're putting all this additional pressure on a pelvic floor that isn't prepared to receive it. When you're lifting heavy objects, whether at the gym or just moving furniture at home, engage your core intentionally. Don't just bend forward from your back and lift with your spine. Use your entire core, your abdominal muscles, your back muscles, everything working together as a unit. Lift with your legs, keep the object close to your body, and breathe properly throughout the movement. And please, try not to lift things that are clearly too heavy or that put you at risk for injury. There's no pride in hurting yourself. Ask for help when you need it. Number 4, have orgasms. This one might surprise you, but it's actually really important for pelvic floor health. Whether you have a partner or not, orgasms are beneficial for your body in multiple ways, and one of those ways is pelvic floor health. Now, I want to acknowledge that approximately 12% of women don't experience orgasms, and there can be many different reasons for this. If you're struggling to have orgasms and you'd like to, I encourage you to see someone who specializes in sexual medicine or pelvic floor therapy. There may be things that can help, but for those who can have orgasms, here's why they matter for your pelvic floor. When you have an orgasm, you're experiencing rhythmic contractions and relaxations of the pelvic floor muscles. These contractions happen at a rate of about 0.8 seconds apart, a beautiful rhythmic pattern. So what's happening during orgasm? Your pelvic floor muscles are contracting, relaxing, contracting, relaxing. They're actually getting exercise. They're going through their full range of motion in a way that strengthens and maintains healthy function. Additionally, when you're aroused, blood flow increases to the entire pelvic region, including those pelvic floor muscles. This increased circulation brings oxygen and nutrients to the tissues and helps maintain their health. So orgasms aren't just pleasurable, they're genuinely good for your physical health. This is one of my favorite prescriptions to give. When you do any type of exercise, you're increasing blood flow to your entire body, including your pelvic floor muscles. Your pelvic floor doesn't exist in isolation. It's part of your whole body system. When you're physically active, everything benefits, including those muscles at the base of your pelvis. Get out there and move your body. It doesn't have to be intense or complicated. It can be as simple as walking. Walking is underrated. A daily walk gets your blood flowing, engages your core and pelvic floor in gentle ways, and supports your overall health. But really, any movement counts. Swimming, cycling, yoga, dancing, strength training, whatever you enjoy and will actually do consistently is the right exercise for you. This leads directly into the next point. When the pandemic started and so many people shifted to working from home, I saw a dramatic increase in patients with pelvic floor dysfunction. People were sitting at their desks all day long, exactly like I'm sitting right now. They weren't taking breaks. They weren't getting up to walk to a different part of the office or to grab lunch with colleagues. They were just sitting, hour after hour, day after day. When you sit for prolonged periods, your pelvic floor is not getting the natural movement and exercise it needs. It's not going through its normal range of motion. The muscles can become tight, weak, or dysfunctional simply from lack of use. You need to make sure you're moving regularly throughout the day. Set a timer if you need to. Every hour, get up and walk around for a few minutes. Stretch, move your body, let your pelvic floor go through some natural range of motion. And ideally, as I mentioned, incorporate regular exercise into your routine. Your pelvic floor will thank you. A lot of times when we talk about pelvic floor health, we hear about Kegel exercises, those contractions designed to strengthen the pelvic floor muscles. And yes, Kegels can be beneficial. They can help with stronger orgasms. They can help prevent urinary leakage. These things are true. But here's what people often miss. You don't want to only strengthen without also relaxing. Your muscles need to go through their full range of motion to stay healthy. A muscle that's constantly tight is not a healthy muscle. It's a dysfunctional one. And a pelvic floor that's too tight can cause just as many problems as one that's too weak. So what I tell my patients is to incorporate stretching exercises that specifically target the pelvic floor. Try happy baby pose, lying on your back, bringing your knees toward your armpit and holding your feet. This gently opens the hips and stretches the pelvic floor. Try child's pose, kneeling and then sitting back on your heels while reaching your arms forward on the floor. This is wonderfully relaxing for the entire pelvic region. Try the figure 4 stretch, lying on your back with one ankle crossed over the opposite knee, then gently pulling that bottom leg toward your chest. This stretches the hip rotators and indirectly relaxes the pelvic floor. And try a deep low squat, just squatting down as low as you comfortably can with your feet flat on the floor, letting your hips open and your pelvic floor release. Pair these stretches with diaphragmatic breathing, taking big belly breaths that expand your abdomen rather than lifting your chest. This type of breathing naturally encourages the pelvic floor to relax and release. These exercises feel good, they're gentle, and they make a real difference when practiced regularly. Consider incorporating them into your daily routine or your regular exercise practice. I was talking with a pelvic floor physical therapist recently, and we were laughing about some of the habits from decades past that we now know are actually harmful. In the 1990s, many of us were taught to sit with our legs crossed and to constantly hold our abs in. Remember being told to suck in your stomach? To always engage your core? This is actually really problematic for your pelvic floor. When you sit with your legs crossed, you're putting all your weight and pressure on one side. You're not properly aligned or stabilized. This can create imbalances that affect your pelvic floor over time. And when you're constantly holding in your core, sucking in your belly, you're basically keeping yourself in a perpetual state of tension. Your pelvic floor is part of your core, so when you're always tensed, your pelvic floor is always tense too. This chronic tension leads to pelvic floor dysfunction. So focus on maintaining good posture, but in a relaxed way, not a rigid, clenched way. Try not to slouch, as this puts strain on your lower back and pelvis. Try not to constantly lean forward, which I catch myself doing all the time, especially when working at a computer. And most importantly, make sure you're not clenching, either intentionally or unintentionally. Some people hold tension in their pelvic floor without even realizing it, especially during times of stress. Check in with your body throughout the day and consciously release any tension you notice. I want to approach this topic with compassion because I know weight is a sensitive subject for many people. But from a purely physiological standpoint, excess weight does put additional strain on your pelvic floor muscles. Think about it. Your pelvic floor is that hammock of muscles at the bottom of your pelvis, supporting everything above it. When there's more weight above, there's more pressure pushing down on those muscles. Now, add other factors on top of that. A chronic cough, high-intensity exercise with jumping or impact, pregnancy. All of these things add even more pressure and strain. Over time, pelvic floor muscles that are constantly overloaded can become weakened and stretched. In women, this can lead to pelvic organ prolapse, where the bladder, uterus, or rectum starts to descend and bulge into the vaginal canal because the supporting muscles can no longer hold everything in place. It can also lead to urinary incontinence, leaking urine when you cough, sneeze, laugh, or lift something heavy. In men, excess weight can contribute to rectal prolapse, where part of the rectum actually herniates through the anus. This is less common, but it absolutely does happen. You want to avoid getting to a point where your pelvic floor muscles are severely weakened. Maintaining a healthy weight is one important way to protect them. This one isn't always on the standard lists, but I think it's incredibly important. Your body communicates with you constantly. When something isn't right with your pelvic floor, there are usually signs: discomfort, changes in urinary or bowel habits, pain during intimacy, that feeling that something is off. Don't ignore these signals. Don't dismiss them as normal aging or something you just have to live with. If you're experiencing symptoms that suggest pelvic floor dysfunction, seek help from a qualified professional. Pelvic floor physical therapists are specially trained to assess and treat these issues. Urologists, urogynecologists, and other specialists can also help. The sooner you address problems, the easier they typically are to resolve. Finally, understand that pelvic floor health isn't about quick fixes. It's about consistent, daily habits that add up over time. The things we've discussed today, not holding your urine, addressing constipation, breathing properly when lifting, staying active, stretching, maintaining good posture, managing your weight, these are lifestyle practices, not one-time interventions. Be patient with yourself, be consistent, and trust that these small daily choices are making a real difference in your long-term health. And that's it. These are the things you need to know to keep your pelvic floor healthy for years to come. Your pelvic floor may not be something you think about every day, but it profoundly affects your quality of life. From bladder and bowel function to sexual pleasure to simply being able to move through your day without pain or discomfort, it all depends on these muscles doing their job well. Take care of your pelvic floor and it will take care of you. If you found this video helpful, please subscribe to the channel. It's a zero-cost way to show your support and helps more people find this information when they need it. Remove these words.